Hello, my name is Richard Barclay. I'm a GP in Kingswood on the outskirts of Bristol. In my 25 years as a GP, I've never seen the system under as much pressure as it is now, and we're asking for your help to help us manage through this next period of time to see if we can all get through this safely together until the vaccination programme kicks in. I've never seen it this busy. The hospitals have been absolutely inundated and are full to bursting. That has a knock-on effect to the rest of the system. As you know, a lot of things may have been cancelled, operations, treatments, and there are people living in pain and struggling with their conditions that aren't getting the treatments they'd normally get. And this brings additional pressure to general practice and on appointments. In addition to that, GPs are working hard to try and support the system, working with consultant colleagues and the community teams to keep people who are quite poorly out of hospital, and those who have been poorly, integrate them back into their homes again. Now that takes additional amount of time as well. On top of this, we've also got the vaccination programme, which is going extremely successfully with hundreds of thousands of people getting vaccines every day. And these vaccines are being done by your doctors and nurses, pharmacists and physios in your practice. So these are the same people as see you on a day-to-day basis. These are the same people who've got their own families in hospital, deaths and bereavements to cope with. So our simple ask to you is to be patient with us whilst we try to help you. If you have serious illness, if you have chest pains, breathlessness, you're bleeding from your bottom or you're bleeding in your wee, then you think you may have cancer or other serious conditions, then general practice is open. We're here for you and we're doing our darn best to keep the doors open. We would ask, if it's not a serious condition or you don't think it is, then have you looked at other ways to help yourself? Have you looked at your practice website? There's all sorts of information, all sorts of pathways that are available to people without seeing your GP, without needing a GP appointment. You can self-refer into a lot of places now, and your practice website is full of ideas about how you can help yourself. Perhaps think about talking to the pharmacist about your issue. That can always be a useful way of getting extra information, as can calling 111. And if you do call us, then please have the utmost patience with our staff. Our care navigators and reception staff are well trained to try and deal with all sorts of problems, and they're under extreme pressure. So please don't take it out on them. Please remember that they're working under extreme duress, trying to get you the help that you need. And if they can't immediately do it, then in the next 5 or 6 weeks, please have extra patience whilst we try and get through this period. If we can do all this together, hopefully things will start to be a bit more normal and we can return to giving you the help that you usually expect and need. Thanks for your help.